I mean, the complete lack of curiosity by your physicians about what are you doing to get better, because maybe I can apply this to my other patients. There's no curiosity. Well, and that's a real shame. I'm frustrated with other physicians that don't say, look at this, we've got all these people getting better. And, I mean, eventually there's going to be some physicians that get it and adopt it, and and the other ones are going to be dinosaurs. I mean, these are the ones that are just going to keep pushing the meds that don't really help. I mean, they help a little bit, but they don't really get at the root problem. And then the other thing is, we always have this, well, what about your cholesterol? And I mean, again, I've asked this question so many times. I'm saying, let's just hypothetically suppose that your risk for cardiovascular disease has increased some number, 10%, 20%, 50%, based upon what you're doing. But would you trade that risk for quality of life? I mean, and I think, the answer is probably yes. I mean, but I don't know. I'll let you answer that.
No, I definitely traded. I think it's always when you look at quality of life, what you need to take and everything like that, and then does it extend your life or not? It's too hard to tell. I mean, if I have higher cholesterol, would it have equaled a heart attack? Would I have already had a heart attack through inflammation anyways? Yeah. So if I'm sitting here with a raging 10 inflammation throughout my body, and now I'm suppressing it, and I know already with psoriasis suppression, with cortisone creams and stuff, it's going to come through another way. So I suppress everything like that. What's the next kind of thing? I'm going to lose eyesight. Oh, that's one thing that does not improve eyesight. So I still need glasses to read. I thought maybe this carnivore would be bulletproof and I would be able to not have glasses anymore for reading. That didn't help. And I did showboat a little too much around my family because they hate when I use the word oxalate whenever they have an issue. I did get COVID 4 months ago. It lasted a couple of days and stuff like that, not to diminish either side of what it is. But when I did get it, they were dancing around rejoicing that Mr. Bulletproof went down. I'm glad I only went down for a couple of days, but I mean, so I have to be careful that just because I feel good, not to kind of showboat too much, especially around my family, because they have a long-term memory, whereas mine is short and I'm already off into the next thing. So I did get hit, but I would trade everything away at this point. And actually, one thing I was going to say, I have a lot of people that say to you, well, you do you, everything seems to be fine with me, so I'm not going to do anything about it. If I had known what I know now, I would go back to when I was still feeling good in my 20s and 30s and change. Because the amount of, eating wise, even if I would just go to a meat dominant with vegetables and some stuff, but I would definitely change what I did, because once the wheels come off, fixing that is a lot harder than if you're already pretty good and you just have to do a slight adjustment saying, you know what, I'm not going to go on a vegetable heavy or grains and all this kind of stuff and smoothies and just go, okay, I'm going to dial that back down, push myself into a heavier meat and animal side of things and do it that way. Because I'm telling you, when the wheels come off, it is an ugly place. And then you're willing to do anything to get over it. And I feel that's where you see all these pop-up things. And that's why people look at it and go, oh, is it really that way? It sounds too good to be true. And in a lot of cases it is. Then you're desperate and you're willing to do anything. I'd hate to have to be in a position where the wheels fall off and I derail into so many scams and other things that are out there. Nobody can scam you going to the grocery store and buying more meat. Nobody's making money on that, just buying it at the grocery store. So I'm not buying any extra stuff, not buying any special pills or anything else like that from some company. So it's all by yourself and repairing yourself.
Yeah, I mean, that's such an important concept of, because a lot of people that do this diet, I mean, they're in a desperate situation. They've got, 20 years of disease and they're just miserable and they just don't see any way out. And it's a shame that it has to get there. And I think if people would just, maybe not, it has to be on a carnivore diet in their 20s, but just get away from all the garbage that we're feeding ourselves because, I think meat is a health food and we should be eating as much as we can possibly, afford, I guess, and focus on that. And it would probably avoid a lot of people from, developing these diseases, whether autoimmune diseases or IBS, or who knows? I mean, there's all kinds of things that we're seeing, mental health issues, which are becoming rampant. IBS, the autoimmune diseases have gone up significantly in the last several decades. It is running up,
Yeah.
and pretty soon, it's going to be everybody has one, and it is a real shame. Do so I mean, you described just eating meat. I mean, is that what you're eating? I mean, you're not including fruit and honey and all this other stuff that some people are promoting. You're just meat only, basically.
Funny you asked that question, because Paul Saladino talks extensively about the adding fruit and raw honey in that. So in September, I was feeling pretty good, and I thought, you know what, I'm going to try adding something in. So beforehand, it was only meat. I did some shellfish, but predominantly ruminant cow and some lamb. I'm not a fish fan, but I did some shellfish and stuff like that, but it was on occasion. That was primarily what I was having. And I would only eat most 2 times a day, just because in the morning I wake up and I would feel good and I wasn't hungry. So I was like, all right, I'll just eat when I feel like it. And usually about noon, I would get hungry, and then I would just eat either ground beef, or I did dip into a pound of bacon or something like that for myself. And that was when I was losing all the weight. So when people say calories in, calories out, I would beg to differ, because at times I was doing 3,500 calories. I worked it out a day, and I was losing at the end of the week 5 or 7 pounds down, no exercise because of my joint pains at that time. And not that I say, hey, don't exercise, just do it. And again, if you're doing it for just weight loss, it is a tough mental gauntlet to run, because you're going, all right, I'm going to give all this stuff up because I want a better body. And I tell you, I've gone from 215 pounds to 175 pounds. Your mental state doesn't change just because you have a good physique and muscles that look good and everything like that. So you can't continue on that kind of path before derailing. And then, if you don't, anyway, that's a different story. So when I started feeling better, I said, okay, well, I'm going to try Saladino's way and add some fruits, and that I'll do one at a time. So I added papaya, but I used yogurt as my vehicle. So it was kind of like a dessert. And then I got some raw honey and I did that. And again, with any response I've had, it hasn't been immediate. And so a week in, papaya, check mark, sounds good. Everything's fine. Week 2, unfortunately, I chose pineapple, and that one hit me in the second day. Bam, full on IBS. It took me 2 weeks to recover from pineapple. So I was like, all right, I can do papaya. So I went back to papaya once everything settled down again. And about 3 weeks in, my psoriasis started to pick up. And I was like, what the heck? Is it from fruit? It can't be. So I cut the fruit out, but I have raw honey and yogurt. And my joint pain started to come up a little bit. And I was like, okay, well, something's on. And the IBS started to pop up. And I think after looking at that, it was the addition, the psoriasis kind of triggered off of the yogurt. So the dairy component of it and the fruit affected the pain level. So I think it was a combination of that. My gut level is not ready to go back after 52 years of abuse. So I think for myself is I've learned that I'm not ready for at least Saladino's kind of talk about adding, these components back because of the level I was in. Because I mean, I had a lot of problems that I was dealing with, and that. Oh, and on a side note, blood pressure, which people always talk, oh, you're going to have high blood pressure because of the salt. My blood pressure was 138, 135 over 80 something. I always forget the second number. It's always one that I don't look at as much as the first number. And now on the couple times that I've been checking and stuff, was either 119 over 72, 125. So I'm right in that area. So I'm back to just meat again and focusing in on dialing that back. And now everything has gotten better again. Pain levels are gone down and stuff like that. I do want to stress that and I use the word stress funny, is that stress does play a component in things.
Mm-hmm.
So there's the diet side of things that really did well for me, but the stress component is something that also I needed to, and I still need to deal with. I'm way too sensitive of a guy. Even coming on this podcast today, I was already 3 days prior to it. I was like, oh crap, it's coming up. What am I going to say? I feel nervous already. I was like, I don't know. I'm just going to be talking to somebody. I was like, I'm really thankful that I was able to have his podcast and listen to him, and I kind of followed it. So he's kind of like my guru, and now I got to talk to this guy, and he's going to interview me. I was like, crap.